Okay. Last time I was talking about the 7 issues where I disagree with the libertarians, and I was focusing on the first 3 I wanted to focus on were issues where the libertarian position actually would lessen social mobility, even though the doctrine makes you think of that's what we're all for, is increasing social mobility, but there's also these ideological positions, and I'm going over those 3. One of those, of course, is what I call the living wage, which in this country is the minimum wage. And again, I'm against Bernie Sanders, $15 everywhere, because it's ridiculous. So, well, we can get into that in a second. But where the libertarians are totally right is the biggest component of the consumer price index and all that is rent. Okay, and this just talking about my state, huge differences in rent. I mean, for $1,500 a month, here you get a 1-bedroom, a studio. $1,500 a month in Los Animas, you get a castle, a mansion. So Bernie's position, $15 an hour everywhere, is idiotic. Owners of businesses in the Arkansas Valley they're not making $15 an hour. I mean, you might as well set off a nuclear bomb. But through the Arkansas Valley, if you had $15 an hour, business would just dry up. Idiotic position, typical of I hate to say it, a liberal Democrat like Bernie. But so let's talk about this. So what we need to do to get rid of the mortgage interest deduction, because that incentivizes everybody to leverage themselves into the biggest possible house. One of the kids on my bus the other day asked me, because we're driving through Deer Creek Mesa with all these huge rich houses, and there are very few children in that neighborhood. These are mostly old people. And he asked, why do so many old people live in these great big homes? And so I explained to him about the mortgage interest deduction. It incentivizes that. And keep in mind that one aspect of this, which I really want to get into later, is that right now we have that age group of 18 to 34, a higher percentage of those are living at home now since 1935. One thing the millennials, who my generation gives so much crap to, that is very similar to the GI generational identity, is that their kids are living at home. And back then it was because the housing market collapsed, housing construction collapsed because of the Depression. Now it's because we're not building the right homes. The homes that are being built are being built for this phony market that's propped up by the mortgage interest deduction. And if we got rid of it, the construction industry would build what there was spontaneous demand for, which is to get young people into homes, all right? But it's not happening because of this. And I know it's popular, but for those of you who I'm trying to convince to vote for me, I am obviously against the mortgage interest deduction. But let's talk a little bit about the living wage. It seems that everyone wants to live in London and Southeast England. You would not believe the price of real estate. A few years back, public sector workers could not afford to live there. Police, firemen, teachers, nurses, etc. were disappearing from the scene. Something had to be done. The living wage emerged. The minimum wage in a region is pegged to average rent in that region. All workers in Southeast England make more than their counterparts in other parts of the country. I would like to see this applied here by government if necessary. Recently in Colorado, we voted to raise the minimum wage to $12 per hour. I, very reluctantly, voted against the measure. In Denver, the average monthly rent for a 2-bedroom apartment is $1,500 a month, and I think it's more now. $12 per hour is not enough. But in the Arkansas Valley, where $1,500 will run a palace, $12 per hour is a kingly wage. I have a friend who owns a Dairy Queen in Los Animas. I doubt that he, the owner, makes $12 per hour. That elevated minimum wage puts many such businesses at risk of failure. Obviously, a compromise is necessary, but can our political class achieve it? No, of course not. Everybody's entrenched, with the libertarians leading the Republicans down the cheap yet ideologically pure reactionary path. I've got some time, so I'll introduce the next part. The second issue where pure libertarianism would restrict social mobility is health insurance. I remember the good old days before Obamacare. They were not so good. Rapidly rising premiums caused, in part, by uninsured deadbeats. Tens of millions of uninsured people clogging emergency rooms for lack of GP care. 50% of all bankruptcies precipitated by a medical emergency, etc. That was before Obamacare, the thing the Republicans thought was so bad. This will be an aggressive argument for single payer, but first let's take a stroll down memory lane on the individual mandate. I should remind you that the argument during the Clinton administration, the first savaging of Hillary, was over the merits of single payer, Democrat, versus individual mandate, Republican. The individual mandate, Romney Care in Massachusetts, then Obamacare nationwide, came out of Republican think tanks. The Republicans won the day. They wanted to save the private insurance market and successfully argued that the industry would contain costs. Part of that argument is the comparison with car insurance. My state requires that drivers carry proof of insurance at all times. We have decided that deadbeats, at least on our roads, are social predators. Isn't someone who sticks us with $1 million hospital bill also a social predator? Allow me to provide an anecdote illustrating the good old days before Obamacare. My insurance agent, a reluctant Trump voter, is one of my closest friends, all the way back to track and field days in high school. He told me a story about one of his frat buddies. One night, my friend spent nearly an hour on the phone with his frat buddy, walking him through a health insurance internet site. They arrived at the point where all that friend had to do was one more mouse click and he would have insurance. The frat buddy said, "Let me think about it." At the last second, he decided he would rather spend that money on something frivolous. Guess what happened the next day? A massive coronary, bypass surgery, millions of dollars of debt. The frat boys hold a golf tournament for him every year to help service the debt. I doubt that it even covers the interest. Guess who actually paid for that surgery? The insurance pool. You and I pay higher premiums to cover the deadbeats. Let's take a look at the socially mobile UK again. Okay, the Conservative Party ideologically dislikes the National Health Service. What do you suppose would happen to the Tories if they tried to dismantle the NHS? Political oblivion. In fact, the Tories always make the case, that conservative economic policies will spur the growth necessary to make the NHS more secure. Here's an even more profound argument. The United States ranks 17th on the Economic Freedom Index. Places like Singapore, Hong Kong, Switzerland, etc. rank ahead of us. All 16 of those countries ahead of us in the ranking have some form of socialized medicine. The Taiwan system especially appeals to me. It is a single-payer system. 5 or 6 companies compete for the government business. I assume that smaller companies compete with designer policies aimed at covering wealthy people who opt out of the government program. The bottom line is that the healthcare industry accounts for just under 10% of GDP. Our system chews up nearly 20%. Imagine the vastness of that additional 10% spread over the entire American economy. Does it not suggest that we have constructed a system where the patient serves the insurance and medical supply and pharmaceuticals industries, not vice versa? One of my heroes is Thomas B. Reed, a Republican Speaker of the House from the 1890s. He once wrestled with insurance companies and reached this conclusion, quote, "Paid once with splendid profits, why should they come again? Simply because incorporated man has the courage sublime enough to put the natural man to shame. Unincorporated man is satisfied to be paid once. How many payments would satisfy incorporated man? Human experience has not yet decided." In other words, if they can get away with it, they will. So far, they have. Okay. I'm going to quit there. Next issue I'll take up will be education. Deal with that some other time. But I want to drive that point home. All 16 countries ahead of us on the Economic Freedom Index have some form of socialized medicine. It is so obvious. If you must protect against a medical emergency, you cannot take entrepreneurial risk. Okay? I mean, the average dude that has some great little idea, he can't do it. That is a social cost that should be spread out over the entire society. For that, and also keep in mind, let's say that I convince this argument finally takes hold into our thick brains, okay? We're still going to have to pay attention as this would work its way through Congress, because those three entities, the medical supply, the insurance companies, and the pharmaceuticals companies, will try to rig that bill to keep their 20% of the economy that they've got right now. All right, we're going to have to be very vigilant no matter what we do. We're going to have to be vigilant. And I'll give you a little clue to watch for is the size of the bill. The Obamacare bill, I think, was 4,000 some odd pages long. Obvious. Well, and the bill that established the Securities Exchange Commission, which protected us for, 7 decades from the kind of meltdown we had in 1929? That was an extremely effective bill. That bill was 83 pages long, and that's an extremely complicated issue. 83 pages long. Simple. What they tell us nowadays, Congress does, is that, we've got to anticipate all these legal issues. That's bullshit, folks. What they're doing is they're working in the special interest groups, company by company, not just sector by sector, work into the bill their carve-outs, the things where it affects everybody else but not us. Okay, that's what those extra thousands of pages are all about. So the thing to watch for is a nice, clean, short bill. And what we all should get into our heads, and I think it should be, if I was president, my thing that I would say to Congress, don't give me anything that's more than 83 pages long, okay? Because if you give me something longer than that, I know what this is all about. That's lobbyists working their pages into the bill, okay? Got to stop that. That's the fleecing of America right there is in those multiple thousands of pages in the bill. So anyway, tomorrow I'll deal with, or whenever I come to this again, education. I'll deal with that education soon.